Go.
Hi, Valerie.
Hello.
My name's Olivia. I'm with Nashville State Occupational Therapy Assistant Program, and today I'm going to be going over just some precautions, goals, and a treatment activity for a burn. Is that okay with you?
Yeah.
Okay, awesome. So first, I just want to go over a couple goals that we have. So for our short-term goals, so this is within 3 weeks. This is what we want you to do. Therapy time, we're looking at 6 weeks to start off. So 3 weeks is in between. We want to hit these goals before we move on to the next. So the first one would be to independently and correctly put on and take off custom pressure garments and gloves. So with a burn, these will be put on to keep the integrity of your joints so you can keep your range of motion. Continue to independently perform active range of motion. So this is doing range of motion by yourself, so up, out, whatever. If it were passive, it would mean that somebody was helping you do it, but you're active, so that's great. You're going to be doing those 3 to 4 times a day. Next is safely and independently perform ADLs, which is your bathing, dressing, toileting, eating, within the home setting, utilizing modified techniques and equipment. And I'm going to be showing some of those equipment recommendations in a second. Safely complete light meal preparation with modified independence. And then lastly is safely complete light housekeeping task with minimal assistance. And that's what we're really going to be focusing on today. Moving on to long-term goals. So this is what we want by the end of discharge. So independently perform active range of motion and functional range of motion of both upper extremities at least 2 times a day. Independently utilize custom pressure garments continuously with the exception of bathing and showering. I know that we previously have talked about how you're getting new pressure garments and gloves, and so we're going to learn how to use those, and you will be able to do that independently. Independently complete IADLs, so that's laundry, home management task, financial responsibility, stuff like that. And again, that's what we're going to be focusing on today. Safely participate in previous social and leisure activities with modified independence. I know that that's really important for you, so we'll make sure that we focus on that as well. And safely participate in previous work activities with modified independence. I can see that you're a teacher, that's great. And then we're going to utilize alternative over-the-counter pain medication while monitoring pain. I understand that there's a little bit of alcohol usage going on, so we definitely want to address that. So just some things that I want to go over precaution-wise. The main thing with a burn is that we're keeping the integrity of the joint. So that means that we need to be positioning ourselves, which I'm sure they've already talked to you in the hospital about. And then we can go a little bit more in depth with that when you're in the bed. But positioning yourself, keeping the integrity of the skin, that's why you have the seats to put in your chair, and just things like that. But also as well, so you got this while you were cooking at the stove, correct?
Mm-hmm.
Okay, so we're gonna go over just some safety precautions about that, just to put it back in your brain about some things that we can do to be safe within the kitchen. Okay, so what we're going to talk about today is laundry. So I know that you are the main person in the house who does laundry, right?
That is right.
Okay. So I'm just going to show you a couple of pieces of adaptive equipment that can help you do that while also, again, keeping the integrity of the joint and keeping your range of motion. So first, what I'm going to show you is a reacher. Have you ever heard of that?
Yeah.
Okay. I'm sure you probably have one of these lying around the house. All right. So this is a reacher.
Mm-hmm.
So you can use this to help laundry by picking it up out of the hamper, picking it off the floor, and putting it into the washer, taking them out of the washer, putting them into the dryer. So again, this is going to help not to overexert those joints in your upper extremities. And then the next thing I want to show you is,
I feel like that's gonna take me forever with as much laundry as I have to do.
it may take you forever, but it's going to help you in the long run to not hurt yourself even more. So this is a rolling laundry hamper. So we certainly, since most of your burns are on your upper extremities, we certainly want to make sure that we're not lifting any heavy objects. That's another precaution we need to be aware of. So having a rolling laundry basket will really help with that. So you're not picking it up and carrying it and then putting it down and picking up all the clothes out of it. And that's where the reacher comes into place too. So just having this will help, again, not overexert yourself and make your life just a little bit easier. And then further on, we can practice using that adaptive equipment, but today I'm just going to show you it. So as far as that goes, do you have any questions?
How long do you think it's gonna be before I get back to more normal?
Okay, so you have 6 weeks of therapy that has been approved, and we are pushing for a day program, which would mean that you go to the local hospital offers this, and you would go to the hospital and spend your whole day there, but you don't do therapy for like 12 straight hours. They have a lot of outings you can do. You can go get lunch, you can go to the aquarium, the museum, whatever. And so that's what we're pushing for. So that'll be, if you can tolerate it, that'll be pretty hard therapy. And that will lead to a faster recovery, but it really depends more on how well you do and how much you put into it. So, you know, the more you do, the more you show up, obviously you're going to get better. But also, a lot of that depends on your doctor too and what he's comfortable with. But we can work with the doctor and we'll all collaborate and talk about the needs that you want. Are there any other things within the home that you're worried about?
No, I can't think of anything other than, I guess I can use that reacher for more than just the laundry.
Certainly. Yeah, you can use that for whatever you need. You can use it for dressing. You could use it for meal prep to get stuff out of tall cabinets.
That's what I was about to say. I have really tall, and it really hurts for me to
Yeah.
go up like that.
Yeah.
So.
Oh yeah, certainly you can use the reacher, for sure. And also that will help with insurance approving that adaptive equipment, because if you can use it for more than one thing, then it usually will get approved. So that's awesome. All right, well, if you don't have any more questions, thank you for your time today, and I will see you next time.
All right, thank you.
Yeah.